Hey guys, welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, a double board certified facial plastic surgeon. And today we have Kelly Herbert, who is the COO of our operations, for our practice. And Kelly's here to ask me some questions.
Yeah, so today's topic is beyond the physical, how facial plastic surgery can change your life. So I'm going to just jump right in and start with some questions. Dr. Ladner, you see the physical transformation, but from my perspective, working with patients, I see a deeper change. Do you notice the same thing?
Yeah, the one word that I always use is confidence.
Okay.
Right. And so it's either newfound confidence or restoring confidence that they used to have. And I think that really summarizes the non-physical experience that patients have, whether it be confidence in the workplace, confidence around their peers, confidence in a relationship, just looking as good as they feel, feeling as good as they look.
Yeah, I think confidence is part of it. I also think it can be deeply emotional and personal for some people. So I've seen some of your results, and we've talked about different augmentations in the past, like a chin augmentation. You have done cheeks or jaw, the mandible, jawline. Those things actually physically change the shape of your face, and it can be an emotional transformation to seeing yourself in one way, maybe not feeling as attractive as you would like to have felt. And so now you've got this newfound face, and it looks different, it feels different. You're really happy. You're getting more positive attention in the world, but that's a big emotional journey to go through. What do you say to your patients that are making drastic changes?
Yeah, so obviously they've thought about it for a while. By the time they've contacted us and set up that consultation, so there are a lot of procedures. You're exactly right. So otoplasty, ear pin back, we're changing their appearance. Maybe they were bullied in school. Maybe they, at some point in time, a friend told them that they have protruding ears, right? So they've thought about it for a really long time, and they are more than ready to move past that and just have confidence in that feature. Rhinoplasties are very similar. We're truly changing their physical appearance. Chin augmentation, we're changing the jawline, the chin, right? There's a lot of procedures where we're kind of rewinding the hands of time, and we're getting people back to where they used to be because they were confident the way they used to be 15, 20 years ago. So like with a facelift, for example, they kind of want to just look and feel as good as they can and get back to a similar appearance that they had a couple of decades ago, right? Versus actually physically changing their appearance. And so I think that by the time someone has come to our office and we're doing the consultation, they've been thinking about this for a really long time, and they're excited about getting that new confidence for something they've had a little bit of self-esteem issues with.
Yeah, and one of the things, just in my own personal life, I'm always aligning myself to the why. Why am I working towards success in my career? Why am I supporting my family in a certain way? I just always think about, why do I exercise every day? Why do I eat the way I do? And when people come in, I think it's really important that they understand their why for plastic surgery. Maybe it was because they were being bullied, and that has sort of weighed heavy on their shoulders their entire life. But sometimes it's external reasons. People are trying to get revenge at a partner, an ex-partner, or they're trying to match unrealistic expectations of filtered social media photos, and they think that those are their real facial features. How are you helping them when they're not clear on their why, and it seems like more external pressures versus something that might be a truly good fit for them?
Yeah, certainly. I mean, I would consider those red flags, right? Because they're not doing it for the right reasons. And this may just be a fleeting thought because, like you said, maybe they had an ex that wasn't so kind and was pointing out stuff that really either didn't exist, or even if it existed, it just wasn't a kind delivery. And so now that becomes their motivation, but it wasn't something that they ever thought about before. So really kind of teasing that out during the consultation process, even before they get to the office, right? The questions that our staff ask, making sure that their goals align with what we hope for them. And then teasing that out during the consult. And if those two don't align, if we feel like there are red flags, they're not doing it for the right reason, they're going to maybe be unhappy because they really didn't want the procedure in the first place. I'm just going to quite frankly say that it's not the right fit, that I don't feel confident, providing this procedure for that patient because I have to advocate for the patient as well.
Now, what about the people who they're really clear on their why, but they're worried that the world is going to think they're vain, that they're superficial because they want to change the shape of their nose or their chin, or they just want to look more youthful and refreshed. But they're really clear. I've made my decision. I want to do this, but I'm afraid of what other people will think. What do you say to those people?
Yeah, I mean, luckily that's becoming less common
Okay.
because these procedures are so much more widely accepted than they were, even 15, 20 years ago when I was undergoing my training. But the reality of it, and I remind, my patients, if they need some gentle reminding, is that we are doing lots of things on a daily basis to try to look as good as we feel, to put our best face forward, whether it be a healthy diet, the way that we eat, exercising every day,
right.
as you mentioned, taking care of our skin just with skincare products, cleaning our teeth. So we're doing all of these other things that if you really take a step back, you'd say, well, those are kind of vain too, right? And so this is certainly no different than a lot of those other modalities. And I think when folks kind of get it from that perspective, they feel better about it and they say, you're absolutely right. And again, they're doing it for them. So they're not doing it because they want a certain reaction, hopefully, from one individual or a group of individuals.
Right.
They want that internal feeling of, oh my gosh, I am so happy. I got that confidence that I was looking for. I got that result that I was expecting. And they find that internal joy.
So just to recap, I'm hearing you say, be really clear about your why. Make sure from an emotional standpoint, you're ready to go through the roller coaster of surgery. And let it be about something you're doing for yourself and never for anybody else, right?
Absolutely.
This is for you. Yes, the world might see you differently in a positive way, but this is really about how you feel on the inside and matching that to your outside.
Yeah, that's exactly right.
Well, thank you so much for
Thanks for
joining
being
me
here.
today. And I'm really glad I got to ask you these questions.
Well, thank you.
Yeah.
If you guys liked what you heard, please be sure to like our video and subscribe to our channel.